Good morning, you guys, and welcome back to another video. As you guys can tell from the title, I am going to be sharing with you guys my gallbladder removal surgery experience. I got my gallbladder removed almost 2 weeks ago tomorrow, and yesterday was my post-op appointment where they took off the tapes that they put in after surgery and then they replaced them with new ones. So I am gonna be talking to you guys about why I got my gallbladder removed, and I checked in once a day, every day, up to a week of my surgery, to just share with you guys how I was feeling, just in case anyone is going to get this surgery soon. But anyways, so it all started 8 years ago after I had my daughter Dana. I got my first gallbladder attack and it was so painful I had to go to the hospital, and at the time they told me that if I kept getting pain, just go back and then they'll do surgery. So within this past year, I feel I started to get pain again, which I hadn't felt in a long time. You know, it had been 7 years up to that point. And I didn't feel any pain until recently, and I would just like kind of tolerate the pain. I didn't really want to go to the ER because I think COVID was at its like highest at the time. So I didn't want to take up any space in the emergency room, you know, if someone potentially needed, you know, to be taken care of. I don't want to be taking up space basically. And I basically just like dealt with the pain, and I wouldn't eat my best. So I think that's what would trigger the pains. I don't know what happened between 8 years and now that I started getting pain till recently, because I think I've been eating the same. Not the best, but also not the worst. So anyways, so I came across this TikTok video, which is the reason why I went to go get it checked, you know, now, that something very tragic happened to someone because they had gallstones. So I was like, you know what, let me just go get checked. I basically wanted to get them removed. I didn't want to be dealing with the pain or just having them in there. So I went and they did like all these tests, and basically it didn't take too long before they gave me my appointment for my surgery. I went in for surgery, and let me go back a little bit. I did go to a pre-op appointment where they basically just talked to me about all the possibilities that could happen. I got these like 2 packets of like wipes, and basically the night before I had to shower and use those wipes to wipe my body, and it's basically kind of like a disinfecting wipe. And I was reading on the back of the bag, or the packet, it said that it I guess it kept disinfecting for 6 hours after you use it. So I'm assuming it's just to like make sure you don't like have any bacteria or anything on you, that way when you get surgery done, like, you know, everything's clean. I had to do that the night before and the morning of. And yeah, and then I went in for surgery, and everyone was so nice. They made me feel so calm and comfortable. The nurses were amazing. When I was about to go into surgery, I got the anesthesiologist. He came in to talk to me about what was gonna happen, what he was gonna do to, like, I guess, sedate me. And afterwards, I think they put something else in me to wake me up, or just like get the medicine out of me or something so I can wake up. Then the surgeon came in, nurses came in, everyone came in that was going to be in that room to talk to me about what was going to happen. So basically I went into, like, right before I went into surgery, they gave me this like relaxant, and it really, really relaxes you. Like I was almost seeing blurry, I think. And they were like, oh, did it kick in already? And, you know, I was like, yeah, it did kick in. And they took me to the operating room, and then I basically just fell asleep. Like, I don't remember anything. By the time I opened my eyes, I could hear them. I think they were waking me up. And because I remember hearing someone say like, oh, wake up, wake up. And then I kind of I didn't really open my eyes, but I was like waking up, you know? So I kind of like moved my eyes, and the first thing that I felt was pain. And it just felt like someone was stabbing me in the stomach, like if the knife was still in there. And I just started to like whine and complain a little bit. And I was just kind of like, oh, it hurts, you know, it hurts. And the nurse that was there, he was like, oh, we just gave you medicine. I gotta wait a little bit. And I guess I just kept complaining like, oh, it hurts. Like, it just felt so painful. And he just went over there and he just gave me more medicine. And I just like felt like almost instant relief. And he asked me like, oh, do you feel better? And I was like, yes, you know, thank you. And then I asked him if he can pass me the phone so I can text Alan and my parents to let them know that I was out of surgery. Also, it was very close to Dana's time to get off school. So I had all of that in mind. So then he gave me my phone and I texted Alan like, oh, I'm out. And he said, oh yeah, they had called him already. The surgery took an hour, which is so fast. Over an hour, a little over an hour. I think I went in at 10 in the morning, 10:10 was my surgery. And by 11:40, I think Alan said, or 11:45, they were already texting him that I was out and that he can come pick me up. So yeah, I texted Alan and he told me that he was already on his way. And I remember Alan got his appendix removed a few years ago. And I remember when I was in there waiting, and I remember they told me that they would be watching him until he was kind of like out of that like sedation mentality or whatever, because you know when they sedate you for like the painkillers, you're kind of out of it a little bit. So I remembered that after my surgery when Alan was gonna come and pick me up. And it was almost time for Dana to get off school. So I told myself, wake up, like snap out of like this fog that you're in, and not pretend, but just kind of like snap out of it so they can let you go as soon as possible so we can still pick up Dana from school. So I kind of like woke myself up and I was just like, okay, I'm ready. And I changed quickly. There was a nurse who helped me change, and I was out, and I don't know, like so fast. I was out, I think, of the hospital by 12:15, I think. And we went downstairs. I got in the car and then we picked up my medicine, which was already ready. They were just waiting for us to pick it up. Alan picked it up, actually. He went in and he picked it up. And then we drove to my daughter's school to pick her up. But the point is that the whole process was so fast. I had to be there 2 hours early just so they can like ask me all these questions, just to make sure that, you know, I got blood work done, because they did ask for blood work and obviously a COVID test 3 days before surgery. And the blood test or the blood work is just to see how your liver is doing. I think just because they're so close together. And yeah, that's basically it. It was such an easy and fast process. I regret not doing it sooner. So if anyone's out there thinking of getting this done, or just like scared of the surgery or anything, like don't be, because it already happened and it's gone. Like obviously I remember it, but I'm just so grateful that I did it when I did, just because now I can just move past that and not think about like, oh, I have stones in me, you know? And they did tell me that you can get them dissolved. I think if you drink certain things, you can get them dissolved, but your body's still gonna produce them no matter what. And they're always gonna keep coming back, and they can like damage other organs in the future. So like it could just affect you later on in life if you have them in there for so long. Also, like they can get so much, like so big that they can do like the cut can just be like huge, you know? So for me, they only did four little holes. And Although one of them was basically the only one that was hurting, the top one was very, very painful. I'm gonna show that afterwards. Okay, so it's been 5 hours since my surgery and I'm really, really sore. My throat is sore because they put a tube down my throat. I'm currently laying down in bed just resting. I've taken, I think, 2 painkillers, I think. They gave me one at the hospital and then one here. And then I have to take one before bed. It's so painful and I've been peeing like crazy. I don't know if it was because of the IV or because I've been drinking a lot of liquids. Probably both. But let me show you guys my scars. Or try. Hold on. I'm laying down. It's a weird angle. So I've been switching off from sitting down to laying down to walking a little bit to then laying down again. Hold on. This one hurts really bad. So I have 4. And I'm super swollen. I think they put like gas in me or some type of air. So yeah, it's pretty painful to get up. So Alan has been helping me so much. And I'm just relaxing and trying to recover here. Oh, I can't even laugh, it hurts. This top one hurts a lot.
This one?
Yeah, this one right here.
Yeah, it looks like the one with the most damage.
Yeah, they say that the belly button hurts a lot too, but I don't feel that one yet. But I feel this one, and I think I feel this one.
Oh, dang.
Oh, don't make me laugh. Oh, dang is right. So painful and so bloated.
I can see it. I can see the bloatiness.
I'm so bloated.
Or not, maybe not bloated, but like swelling maybe?
Yeah, I'm swollen and bloated because they put air in my stomach.
Oh, they did?
They put air in my stomach. That way I can inflate and they can like get to it. I woke up this morning and I felt better, just really, really sore. My throat is better. And then not too long ago, maybe like 40 minutes ago, 50 minutes ago, I started feeling really bad pain because I hadn't taken my pain medication because I didn't want to be taking that strong, that strong pill that they give us. Because they give me 2 medicines. One is like a strong Tylenol. And then the other one is more like a drug with Tylenol. And I didn't want to take that one too often. So I took it yesterday. And I was planning on not taking it today. But my stomach was just hurting really bad, to the point that I felt like my chest was hurting to breathe. So I drank the pill and I feel so much better. So yeah, and I'm wearing the same shirt. Don't judge, but they gave me the okay to shower tomorrow. The only thing that I did was change my undershirt. But let me show you guys my battle wounds. I can't laugh, it hurts. Let me show you guys. I'm less bloated today. Hold on, let me pick it up. So there's my stomach. It's a little bloated. I'm still bloated, but it's not as bloated as yesterday, I feel. And like I said earlier, this one hurts, and I feel like this one is starting to hurt too. But yeah, they called me this morning also to see how I was doing, how I woke up. I drank a green juice today just because I'm trying to keep it light. It was a beet juice with like all these other goodies in it. But yeah, and I'm taking it easy. I've been walking around for I don't know how long, an hour maybe. I take little breaks here and there, but yeah, with that pill, I feel like I can walk more. I didn't think I was gonna be in this much pain. I was like, I'm just gonna like not take the pill anymore. But no, I need it. Okay, so it is day 2 now, and I was finally able to shower, and I feel so much better. I have not taken any pain medication, but my scars and everything still looks the same, so I'm not going to show you guys that again. I just feel sore, like super sore. The ones that I feel the most are the top ones, but other than that, I feel okay. I don't feel like my chest hurts that much anymore. And I've been eating avocado toast, and last night we ate a little bit of chicken with rice, and I was able to eat a little bit of that, and my stomach didn't hurt or anything. I felt okay. So the good thing is that every time I eat, it doesn't make me feel weird or make my stomach hurt. So I'm gonna see if I can try to go without drinking the pain medication today. See how that goes. That way my body can heal on its own without any help. It is day 3 now, and I'm feeling so much better. I haven't taken any pain medication since yesterday, and I'm able to stand up and sit down on my own now. Before, Alan used to help me stand up and sit down. The only thing that I need help with right now is getting up from the bed. That's still really hard for me because I feel really, really sore. And it's been really hard to not laugh because it hurts so bad, but like, maybe not so bad, but like I feel just super, super sore. So I've been telling Alan and Dana to not make me laugh because it's just so hard, because like we're always laughing and saying funny things. So that's probably been one of the hardest things. Also, no, not even. That's not the hardest thing. The hardest part about all of this is that I can't rock my baby to sleep. Well, he's not a baby anymore. He's 2.5. But that's one of my favorite things to do is put him to sleep, and I can't pick him up. I can't carry him right now. So it sucks. So I can't wait until I'm fully healed so I can do all those things again. But physically, I'm feeling so much better. And yeah, I think we are doing very, very good for it being day 3. I can't wait how I'm going to feel next week for Thanksgiving. But yeah, this is today's update. Okay, so it is my 7th day post-operation. I am feeling the best I've felt all week. Obviously, I'm going to be feeling better each day. Tomorrow's Thanksgiving, so I'm excited to be able to eat some food. But as far as like the pain level, I can laugh again without feeling that much pain. My incisions, they look really... So my appointment is on Monday to go get like the tape removed, and today is Wednesday, so I'm not going to show you guys what my stomach looks like because the cuts or like the tape just looks disgusting. I've been cleaning around the areas just to like keep it clean, but I can't take off the tape or anything until the surgeon takes it off on Monday. So I might upload this video till after that appointment. That way I can show you guys what the scars looks like, because I know that they told me that they're going to take off this tape and put either new ones, like something that's thinner maybe, or something that's not as like strong, and that's gonna happen on Monday. I'm not feeling bloated anymore. My around like the incisions, like around the tape, I can see that it's starting to get like bruised. So I can feel a little bit of the bruising, but like the inside doesn't hurt anymore, because when I would laugh, I just felt like it was so painful. And Alan was telling me that he thinks salud bebe. Alan was telling me that he thinks that it might be like the inside where they took out my gallbladder, what was hurting when I would laugh, because the cuts themselves don't really hurt me, but the inside was what was hurting me. So I felt like it was super, super like sore. And I was talking to one of my friends on here, Andrea, and she told me that the way that I was describing the pain was the way that she felt when she had a C-section. So I don't know if any of you guys have had a C-section, or, you know, maybe can relate that way. But yeah, I feel so much better now. I've been eating normal. I was noticing that my stomach would hurt a little bit when I would eat very heavy foods, but now like I'm getting used to it. And by heavy foods, I mean like chicken and rice. Like I'm not eating like greasy like pizza or anything yet, but I feel good. I've been off the medications for, I don't know, 3-4 days now. I think I took them only the first 2 days or day and a half, and then I try not to take them anymore. And let me see, I can get up from the bed now by myself. I don't need Alan's help anymore, so that's good. I might wait until after Monday to post this. That way I can show you guys how my stomach looks. I'm not gonna show it right now, like I said earlier, because it just looks disgusting. But yeah, I'm feeling good. And yeah, that's basically my 1 week update, and then I'll do one last one after Monday. Okay, so that's my daily check-ins. I know I think I missed like a day or two, but basically those days I just felt the same. I didn't want to check in and just keep repeating myself like, oh, I'm feeling better, I'm feeling better. Of course you're feeling better, you know, days are passing by. But, you know, just so you guys can get a glimpse of what it was, I'm going to show you guys one last stomach picture or video, I guess. Okay, so one last belly shot. This is what my cuts are looking like right now. And yeah, I think they're healing very well. I did get the tapes replaced yesterday, and they're looking so much better. But I did bleed from the top one where they actually pulled out my gallbladder. That one was the most painful one, and that one still bled a little bit yesterday, and the one all the way in my side. But the surgeon told me that that's completely normal and I'm healing well. I did take, oh, I forgot to mention, of course, I got pain medication, and they give you 3 medications. They gave me a Norco pain medication, which is like a drug. And then they gave me like they told me it's like a strong Tylenol. And then they gave me like a stool softener, because I guess you get constipated with the painkillers. So I didn't need the stool softeners. Luckily, I didn't have no problem with that. I did drink the Norco pill the day of when I got out of surgery, and the day after. And then on the 3rd day, I only took one of the Tylenol pills, or the strong Tylenol. I'm not sure like the exact name to it, but I took that one on the 3rd day. And then after that, I just stopped taking medicine, because I just wanted to let my body heal and kind of not deal with the pain, but just get used to being without medication, just because I don't like taking none of those drugs or things like that. And then I just kind of dealt with it. And I kid you not, every day I felt like the pain was so much less, but at the same time I still felt like a good amount of pain, or maybe not pain, but soreness. Like I felt really sore, but I saw huge progress each day, is what I'm trying to say. So it wasn't as bad. Yeah, I definitely feel like I healed fast because I had the help. So if you can have someone help you after surgery, that would be amazing, because I honestly feel like if I didn't have his help, I would have not been as healed as I am now, I think, because I've had so much rest that my body has just had the time to heal. So yeah, and I did walk a lot after surgery. The day of, I came home and I laid down. I think I fell asleep for a little while, and then I would walk. I would go use the restroom. I would come outside. I would just try to walk as much as I could, because they did say that if you don't walk a lot, you could get pneumonia or blood clots. And of course, I didn't want any complications. So I did what I had to do, and I tried my best. And yeah, but I also would sleep when I felt really tired. I would rest when I needed to. Like, I listened to my body. If I was tired, I would just go lay down and go sleep. Like, I wouldn't hesitate to just stay up and, you know. I don't know if I missed anything, but if you guys have any questions, you guys can comment them down below or send me a message on Instagram. Or if I have enough questions, I could just make another video, just a little Q&A, a short video or something. But for the most part, I think I went through everything. So yeah, this is where I'm gonna end today's video. Thank you guys for watching. I will see you guys in the next one.